In a world where nurses are needed everywhere, what truly shapes where they choose to serve? Good day, everyone. I am DOMINIQUE Valencia, and together with me are my co-researchers, Angel Grace TOLOG, John Joshua VINGCO, and LEIRA ISABEL YANOC from Group 4B of BSN 3D, presenting our study entitled Clinical Self-Efficacy and Career Preferences on Specialized Nursing Practices among Graduating Nursing Students. To begin, the purpose of our study was to analyze the relationship between clinical self-efficacy and specialized nursing career preferences among graduating nursing students. Specifically, we wanted to determine whether demographic variables such as sex, socioeconomic status, and section influence specialization preferences, and whether clinical self-efficacy affects the students' chosen nursing specialties.
For our methodology, we utilize a quantitative descriptive correlational research design because the study aimed to examine relationship between variables using numerical data gathered through survey questionnaires. The participants were 127 graduating nursing students during the second semester of the academic year 2025-2026. The respondents were selected using stratified random sampling and fishbowl sampling techniques to ensure fair representation from all sections. For the research instrument, we used a three-part questionnaire. The first part gathered demographic data. The second part used the Modified Nursing Student Self-Efficacy and Clinical Skills Scale, or NSSECS, composed of 48 items measuring students' confidence in performing clinical skills. The third part was a research-made questionnaire measuring preference in 7 specialized nursing fields: community health nursing, pediatric nursing, obstetric and gynecological nursing, medical surgical nursing, mental health nursing, emergency room nursing, and gerontological nursing. The instrument underwent content validation and reliability testing. The NSSECS obtained a Cronbach's alpha of 0.926, indicating high reliability, while the specialization preference scale obtained 0.771, interpreted as acceptable reliability. For statistical treatment, we use frequency distribution, mean, standard deviation, Mann-Whitney U-test, Kruskal-Wallis test, Spearman rank correlation, and chi-square test of independence. Let us now proceed to the results and discussion, starting with Table 1, which represents the demographic profile of the respondents. The findings revealed that majority of the respondents were female, comprising of 74.8% or 95 students, while male accounted for 25.2% or 32 students. Most respondents also belong to the middle-income socioeconomic category. In addition, respondents were proportionally distributed across the 5 sections. These findings reflect the continuing dominance of female in the nursing profession and provide a balanced demographic representation for the study.
Moving on to Table 2, which presents the level of clinical self-efficacy of graduating nursing students. The overall mean was 4.04 with a standard deviation of 0.47, interpreted as confident. This indicates that the respondents generally perceive themselves as capable and competent in performing clinical nursing skills. When grouped according to sex, female respondents obtained a slightly higher mean score of 4.07, compared to males with 3.94. Although both remained under the interpretation of confident. When grouped according to section, all sections also fell within the confident level. BSN 4C obtained the highest mean score of 4.21. Similarly, when grouped according to socioeconomic status, all categories still demonstrated confidence in clinical performance. This suggests that graduating nursing students generally possess strong confidence in their clinical abilities regardless of demographic differences. Next is Table 3, which presents the preferred specialized nursing practices when grouped according to sex. The results showed that both male and female respondents highly preferred medical surgical nursing and emergency room nursing. For emergency room nursing, males obtained a mean score of 4.03, while females obtained 4.06. Both interpreted as high preference. Medical surgical nursing also received high preference scores from both groups. Meanwhile, community health nursing, pediatric nursing, and gerontological nursing were all interpreted as moderate preference. One notable finding in this table is obstetric and gynecological nursing. Female respondents rated this area as high preference with a mean score of 3.66, while male respondents rated it only as moderate preference with a mean score of 2.84. This may suggest that female students are more inclined toward maternal and reproductive health care settings. Now let's discuss the Table 4, which represents specialization preferences according to section. Emergency room nursing consistently emerged as one of the highest preferred highest preferred areas across all sections, particularly among BSN 4C students who obtained the highest mean score of 4.37. Medical surgical nursing also remained highly preferred across sections. These findings suggest that students are strongly attracted to acute care and hospital-based nursing specialties due to the fast-paced environment and opportunities to develop clinical skills. Next is Table 5, which presents specialization preferences according to socioeconomic status. Regardless of socioeconomic classification, emergency room nursing and medical surgical nursing remained among the most preferred specialties. This indicates that socioeconomic background may not strongly influence specialization preference among graduating nursing students. Moving to inferential statistics, Table 6 presents the difference in specialization preferences according to sex. The findings revealed that most nursing specialties showed no significant difference according to sex. However, obstetric and gynecological nursing showed a statistically significant difference. This means that sex significantly influenced preference for OB/GYN nursing, with female students showing greater preference compared to males.
For Table 7, which examines differences according to section, most nursing specialties again showed no significant differences. For Table 8, which examines differences according to socioeconomic status, the finding revealed no significant differences across all nursing specialties. This further supports the idea that socioeconomic status does not strongly affect specialization preferences. Now we proceed to one of the most important findings of the study, shown in Table 9. Table 9 presents the relationship between clinical self-efficacy and specialized nursing practices. The findings revealed that significant relationships between clinical self-efficacy and several nursing specialties, particularly community health nursing, pediatric nursing, obstetric nursing, and gynecological nursing, medical surgical nursing, emergency room nursing, and gerontological nursing. Emergency room nursing and gerontological nursing both obtained highly significant p-values of 0.0000. This indicates that students with higher clinical self-efficacy are more likely to prefer technically demanding and hospital-based specialties. Interestingly, mental health nursing showed no significant relationship with clinical self-efficacy, suggesting that other factors such as personal NRes or clinical exposure may influence preferences in this field. Overall, the results imply that self-confidence in clinical abilities is a strong factor influencing specialization decisions among graduating nursing students. In Table 10, most specializations showed no significant relationship with sex. However, obstetric and gynecological nursing showed a significant relationship with a p-value of 0.021. This indicates that female students were significantly more likely to prefer OB/GYN nursing compared to male students, possibly due to greater interest in maternal and reproductive health care. For Table 11, most specializations also showed no significant relationship with section. However, pediatric nursing showed a significant relationship with a p-value of 0.010. This suggests that students' preferences for pediatric nursing varies across sections, possibly due to differences in clinical exposure, instructors, or learning experiences. Lastly, Table 12 revealed no significant relationship between clinical self-efficacy and socioeconomic status. This indicates that students were generally confident in their clinical abilities regardless of their economic background.
For our conclusion, the study revealed that graduating nursing students demonstrated a confident level of clinical self-efficacy and showed strong preferences towards hospital-based specialties, particularly medical surgical nursing and emergency room nursing. Most demographic variables did not significantly influence specialization preferences. Instead, clinical self-efficacy emerged as a stronger factor affecting student specialization choices. The study highlights the importance of strengthening clinical exposure, competency-based training, and mentorship programs to further improve students' confidence and readiness for specialized nursing practice. Based on these findings, we recommend that nursing schools provide equal and enhanced exposure to different clinical areas, especially less preferred specialties such as community health nursing, mental health nursing, and gerontological nursing. And that concludes our presentation. Once again, thank you for listening and have a great day ahead.